Hi guys, good afternoon. This is Laura, the pharmacist at Alameda Thrifty. You all know me there as the pharmacist, but I'm also a mom to an Old English Bulldog. She's 9 years old. Her name is Shelby. You guys have probably seen her. Sometimes we feature her and her best friend Grizzly, and basically we call her our pharmacy dog. But recently she's had to have a mammary tumor removed at Eastwood Animal Clinic. By the way, they were great at taking care of her, but it's been a huge recovery, and I always talk about pet CBD in the pharmacy, and I just wanted to actually show you how much it's impacted what we're doing with her at home and her real true regimen at home. I wanted to kind of bring you guys a down-to-earth video, just really showing you our weekend and the care for her right now during the recovery of after the removal and the stitches. I will try to link or at least comment below all the items and products that I show or that we use, and bear with us as we are new to these videos, and we're going to try to put this one on Instagram and our YouTube and Facebook. So just bear with us, be kind please, and let us know if you like it and you want to see more videos and content like this. So I am going to show you now some of the products that she is truly using and the way I'm using it for her. Okay, I did not get to mention that I am recording outdoors, as you can tell, so excuse the background noise, and my neighbors are outside having fun in this beautiful Sunday here in El Paso. So I just wanted to say I am outside. Okay, so this is some of her antibiotics that she was on and still is. They're very heavy duty, so I just wanted to say, first of all, some of the things we noticed right away is that she had to have these antibiotics because her sutures it was a pretty big stitch, about 9 inches long along her belly, and so it took some antibiotics to keep infections at bay. But that definitely, again, just like with humans, that took a lot on her stomach. So I did talk with my vet tech there at Eastwood Animal Clinic if I could do some liquid probiotics for her. This is the same one that my whole family uses, and so now we're adding this to her food. And initially, I was giving her a little bit of the CBD dog treats from Lazarus. I really like these. There's 5 milligrams of CBD in each treat. I like them because they're grain-free as well. Just like we don't want as much grain in our foods, we don't want it for our pets either. But I found these to be, after I was in the real, I guess in the real midst of it, it's not enough maybe for her at night because she was starting to use her hind legs to scratch, even though she has the e-collar on. So these we're still giving it to her maybe once or twice during the day, just to keep her a little calm and not messing with her sutures so much. But I moved on to the liquid Lazarus CBD for pets now, and this has been amazing. And this, I'm doing it in the evening, almost maybe about 0.5 to 0.75 mLs. I love it because the dropper is so nicely calibrated, so you know exactly how much you're giving. This one is salmon flavored, but we do have the tasteless ones and the sensitive pet one that has no THC. So for Shelby, based on her weight, she can get between the 0.5, see that line right there, and 0.75. She can even get up to a whole 1 ml. She weighs 58 pounds. But it does have on the box the pounds. So this I just add into her food. Why do I do her food? Because I know she'll eat all her food. And if I just add it to her water, I won't be sure if she got the full dose. So I will add the CBD on top of also adding the probiotics. And this one is going to be 1/4 of an ounce. So I will pour this. Let me look for the 1/4 ounce here. And that's actually how much my children and I get, is 1/4 ounce. My son, he does take 1/2 ounce because he's using it more for the skin, for teenage acne, so that helps him a little bit better. But my husband, my other daughter, and myself, we just do 1/4 ounce a day, and now Shelby's getting it as well every day, just for that gut health. It really helped after about 2 days being on the antibiotics and then the probiotics. I saw her stools getting a lot firmer, and she didn't have so much diarrhea. I also wanted to mention that on her antibiotics, I split them up, so I start getting one in the morning, one in the evening, and I definitely make sure to feed her both times. She didn't used to get fed twice a day, but because of the regimen she's on, I'm feeding her smaller amounts, but twice a day, so she can take her medicine with food. So I'm going to go ahead and show you how we do the rest. So I had already pre-portioned out some of her grain-free kibble. I am going to take the Lazarus salmon flavored pet CBD and just add it right there on top. second so you can see the markings maybe. I really like the markings on this. It tells you clearly how much. And if your pet, you feel like your pet's a little bit too drowsy after it, you may just want to dial it down a bit, but you can easily change that on your own. We had already poured out the probiotics, so I will just add that there and let it kind of, she likes her food a little bit wet anyways. And now the fun part, we need to bring Shelby out. Okay, now that we have the patient, let's take off her soft collar. This Zen comb is amazing and super easy. So it's much more comfortable than the one that we went home with. And since she's gonna be about 3 weeks now on it, because the sutures weren't ready to remove yet. And I love the Zen comb. You just tie it into your normal collar, and it's super easy to come on and off. So now she's gonna take the one antibiotic that she's due for at this time, and she'll cooperate. Remember, we're using a real dog, no training here. Let's see, sit down, come over here, sit down, sit, good girl. And she likes that one. It's a chewable. And then it's got the CBD and her probiotics here in her kibble. And I hope you like the video. Again, the Zen collar is what we're using right now. And let us know how you like this informational video from your pharmacist. And if you have any other pharmacist questions, just let us know or tell us what you want to see next. Thank you for watching. Bye.